Biopsychosocial Paradigm, Pi Perspective, and Bronfenbrenner's Ecological Theory by Joseph Kellerman for Ashford University Class SOC 313, Instructor Dr. Sandra Smith, October 26, 2014, 5 days prior to Halloween. Of the three theories listed above, I wanted to focus on the biopsychosocial paradigm, as it is the same approach to healthcare that the hospital I work at uses. So let's start off by defining the biopsychosocial paradigm. A biopsychosocial approach to the treatment of patients involves biological, psychological, and sociological dimensions. All of these elements are taken into consideration when planning the care of a patient and are intertwined together as the graphic shows. The psychological profile or the mindset of the patient will contribute to their health or recovery from an illness or procedure. The relationships they have with their family, friends, and loved ones as well plays a role in their health. And of course, there is always the hard science of the patient's genes, medications they are taking, and their personal neurochemistry to factor in. The more positive these elements are, the better and faster they will recover and heal. At Gila Regional Medical Center, we use a holistic healthcare approach which the biopsychosocial theory favors. This is the art and science of healing that addresses care of the whole person, body, mind, and spirit, according to the American Holistic Medical Association. Body is, of course, more the standard biomedical part, but appealing to the mind with relaxing colors and creating an environment that makes them feel more comfortable, as well as taking into account their religious and cultural beliefs, puts together a complete healing package. The patient can feel more comfortable overall so that they can work on feeling better. So let me define the other two theories. Pi, the person and environment approach, views the individual and his or her multiple environments as a dynamic, interactive system in which each component simultaneously affects and is affected by the other. These environments and relationships are viewed as an ecosystem. The idea is that through intervention, both socially and psychologically, the individual can be helped, beginning with psychotherapy and clinical social work, going through family therapy, group work, empowerment, case management, mediation, and ending with social development. Having been a foster parent and working with child services here in New Mexico, I have seen this method in action, defining a child's ecosystem and identifying all the areas a child's life touches, be it school, teachers, family, friends, doctors, etc., and understanding how removing the child from that ecosystem, even if it is unhealthy, is extremely disrupting and has a huge impact on a child's development and behavior. Bronfenbrenner's ecological theory, like Pi, is also based on an individual's social ecology. This model proposes 5 distinct environmental layers: microsystems, mesosystems, exosystems, macrosystems, and chronosystems, and allows for a way to study and describe how the relationships between the various layers of the ecology interact. Everything that is in the individual's world, from their family and friends to even the development level of the country that they might be from, as well as the social and cultural aspects of the person, can all be studied and analyzed to see what impacts they might have on the person's health. For example, a patient from an industrialized country will have access to better health care and resources than someone from a less developed third world country, where the necessary medical procedures needed to treat their illness may not be available. Now that we have defined the theories, it seems to me that the biopsychosocial theory would easily be supported by the other two. The biopsychosocial model requires that caregivers and physicians delve into the lives of their patients and understand all the elements, positive and negative, that impact their health. Do they have the social economic means to provide a healthy lifestyle? Is there a strong social support structure to help a person to recover? What stress factors could impact the patient's health? And what can be changed to allow for a healthier way of life? All of this information could be gained by using either the Pi theory or the Bronfenbrenner approach. I feel strongly, however, that the biopsychosocial theory would be the best in using that data and applying it to the treatment plan of a patient to ensure the best chance for success.